Hello friends, my name is Palash and today we'll discuss about the Passbox in Pharmaceutical Facility. This is our first official shorts on our YouTube channels, and I would like to wish everyone a happy New Year 2024. Passbox are generally two types. One is static passbox and second one is dynamic passbox. Static passbox are normally installed in the unqualified or like uncontrolled and classified areas, and whereas dynamic passbox they are installed in the higher grades like grade C or grade D. Dynamic passbox are work like your laminar flow hoods or the airlocks. They can be like shrink type, cascade, or bubble. The principle or the way it's work, it does not allow the air of the lower grade to the higher grade. So it's like a barrier to the contaminations. Like it's improve your contamination control, and it's like act as a barrier in your area when you're transferring some goods from one lower grade to higher grade, or maybe the same grade of higher cleanliness. So if we closely look into the design of the pass box, it's normally built with the SS box with the glass windows with magnetic doors to prevent the opening, and it's with the interlock. Whenever you're opening from the other end of the door will be the closed automatically. It will have the alarms, and it will have the velocity control. The major parts it has installed like the blower, HEPA filter, pre-filter, or the makeup filter, you can say, like, and pressure gauge to measure the pressure in between, differentiate pressure in between two areas. And if you want to talk about the qualification of the pass box, these are the major tests need to be performed when you want to qualify the dynamic pass box, like air velocity test, HEPA filter integrity, pressure differential, and airflow visualizations, and non-viable particle count. Thank you, friends.